Hello, my name is Brian Moores. I am a weight loss surgeon at Bariatric Medicine Institute in Salt Lake City, Utah. Congratulations on making it to your pre-op visit with our group. Today I'd like to just summarize some of the pre-op, hospital, and post-op care for your weight loss surgery. The goal of this video is to briefly summarize some of the common questions that we get asked during this visit and to serve as a resource for you moving forward if you have questions. Your best resource for questions, though, is the guide provided to you by our office, as it has the most detailed information. Let's talk a little bit about wound care. After surgery, you'll have 4 or 5 small incisions on your belly, and those incisions will be closed with either suture or with staples. In general, we'll recommend that you shower daily with soap and water starting 2 days after your surgery. You may have some band-aids in place, and you're welcome to take those band-aids off 2 days after your surgery, and once you remove them, that's when you may start to shower with soap and water. You don't need to do anything special for your incisions. We recommend patting them dry after showering, but you may leave them uncovered. Some people like to place small band-aids over them to prevent clothing from scratching on them or to catch any mild amount of drainage. Some people may have some very clear straw yellow drainage. That's healthy serum. Things that you need to call the office for, or if you start having redness that's spreading aggressively around an incision, or if you start to have pus-like drainage from your incisions, as those may indicate infection. If that occurs, the best thing to do is start taking daily pictures, send them to the office, and call us as well. Now, for your staples or your sutures that may be in place, we recommend removing the staples at the 2-week mark. You'll be sent home with a staple removal kit by the hospital. Or if you have sutures, you'll remove those sutures at the 3-week mark with the suture removal kit. If you have trouble with either of those, you're also welcome to call the office, and you can come in for an appointment to have our MAs or providers assist you in removing them. Let's talk about your follow-up schedule. In general, once patients are discharged from the hospital, we'll call you on Friday, the same week of your surgery, to check in and see how you're doing with your liquids, if you're having any pain issues, or if you've had any emergency needs. And then you'll have a visit scheduled at 2 weeks with either one of our mid-level providers, our PAs or nurse practitioners, or you may see your surgeon as well. After the 2-week visit, you'll be seen monthly with the diet and exercise team until your 6-month checkup with the provider for your labs. We do like patients to continue visiting monthly with diet and exercise until they've reached their weight goal. For patients that have had the duodenal switch, you'll continue to see us every 6 months for the first 2 years with labs to check your vitamins. And then after 2 years, we go out to every year with labs. For the sleeve, it's very similar. It's every 6 months for the first 2 years, and then yearly afterwards, also with labs. Next, we'll talk about some frequently asked questions for directly after surgery. Hopefully, I've answered any questions that might have come up regarding the immediate pre, post, or intra-hospital care visit, but some things we commonly get asked are, when should I expect my first bowel movement? Well, first, everyone's different, but in general, people should be passing gas at least 2 to 3 or 4 days after surgery, and then most people should have their first bowel movement by the 4th or the 5th day after surgery. Now remember, you've been on a liquid diet for several weeks before surgery and after surgery, so your bowel movements may not be solid, they may be soft, they may be liquid. It is important to call the office if you haven't had a bowel movement by day 6 or day 7 and you're starting to feel constipated, bloated, or nauseous. It may be time to start a laxative or do an enema for severe constipation. Another question we commonly get is, why does it hurt when I eat? And remember, the stomach is a very large blender. It takes normal food, it puts acid in it, and then turns it into basically a smoothie. And when we make that stomach smaller, it's very common for patients to experience spasm. The stomach is not squeezing in a coordinated fashion, and so when you eat or drink, the stomach tends to spasm. One medication that we find useful for that is icosapent or Levsin, and you can take 1 to 2 tablets 3 times a day. That should decrease the intensity of those spasms, but it won't make the symptom go away altogether. Some people find dexamethasone helpful for that spasm discomfort as well, as it can decrease the inflammation of the stomach. Other patients ask, why am I nauseous? Nausea is one of the most common symptoms after any weight loss surgery, and the key reason is that's how the stomach communicates that it's been injured, or it's how it communicates that it's full. So nausea is a normal symptom to be experiencing, and you can expect it to get worse when you eat or drink. Again, you do need to push through this symptom and continue to drink 64 ounces a day. And we do recommend that you take Zofran or dexamethasone to help control this symptom. And if those don't work and you start having constant nausea, severe nausea, or vomiting, those are alarm symptoms that you'll need to call the office and discuss further. Lastly, we do hear that patients sometimes are getting dizzy or fatigued. And this can be a spectrum of severity. Often people can be feeling fatigued or dizzy because they're either having low blood sugars, they are getting dehydrated, not drinking enough. So it is important that we start doing 1 to 2 protein shakes a day, and that we're getting a minimum of 400 to 600 calories a day, and that you're aiming for at least 64 ounces of liquid intake a day to prevent dehydration. Again, if your dizziness or fatigue is getting to the point where you can't stand up and be steady, if you're unable to get up and even use the restroom on your own, these are warning signs that you should be calling the office and getting additional workup. So in closing, I hope that this video helped answer some of your questions for before and after surgery. Keep in mind that there may be specifics about you or about your health that may need to be discussed further with the provider, and that's the point of your clinic visit, is to go any specific details to you. This video just serves as a brief overview for the common questions and issues so that you come prepared to your visit. We look forward to seeing you at surgery, and we hope this process goes smoothly. Make sure to touch base with the provider or the office if there's anything that's unclear. Most of the detailed information can be found in your pre-surgery packet, so make sure to read and review it before your surgery.